Hi, sciatic pain. How do I get it and how do I get rid of it? This is Dr. John Gray coming to you with our second part of our four-part series on sciatic pain or sciatic-like pain and the things that can mimic it. Today, we're going to talk about disc. Last week we talked about piriformis syndrome, and today we're on part 2 is going to be about disc. A lot of the problem with the disc is loads are unevenly put on a squishy surface that sits between two bones here. These discs look a lot like a radial tire. If you look at them, they'll have tissues going one way, and then if you go a layer down, there'll be tissues going the other way. And so they get congruent. And then when this tissue here that has a soft center, if you get unloaded evenly on this or too much load, then that'll push out in one of these directions. It'll break enough of these fibers, these belts on the tire, so to speak, and this tissue comes out. The problem of that is when that comes out and it gets in this pattern here, right here where the nerve comes, and then that starts putting pressure on the nerve, or it can put pressure here in the center, which is even harder to fix. So the first thing we want to do is we want to make sure that the pressure is evenly distributed through all the joints and we're not loading up. In other words, if we don't bend or twist and we don't have good flexibility or mobility in the spine, then that can load up an area and have one area do more work than the other. Kind of like if you think about it, if the road crews out there, if you ever see 4 guys on a shovel and one guy's doing all the work, that's what can happen in the back. When that happens, that guy that's doing all the work will eventually break down because he's doing the work of 4 guys. And so this is what it looks like. This is a little picture there. If you can see that, where that material starts to break through and go out into one of these areas. The nice thing is the more you keep these areas adjusted and moving equally, the less likely you are to create those hot spots or to have one guy doing all the work. The adjustment makes those areas all share the work. But what if you already have the problem? Well, there's 2 parts there. One, doing what we just talked about will help. Putting the workload on others will help take some of the pressure off of that area. The second part is we can do, if you have an area that's bulging like this, by putting you in a traction, it pulls these vertebrae apart and that will naturally suck back in. And then it's a matter of holding it there and doing that enough times that those tissues will scar over into that bulge so it's less likely to bulge back out. And one thing we also like to do is the material in the disc can be very caustic to the nerve. People used to think it was all about the pressure on the nerve that was causing the pain, but they find out the chemical from the disc itself is just as irritating. And typically we'll use, you'll see anti-inflammatories, ibuprofen, Tylenol, those type of drugs used for this issue. And what they're doing is they're just shrinking the inflamed tissues around that area. They don't do anything for the disc, but they're shrinking anything else in the area that they can to give more space and to numb it up a little bit. But as you've been reading lately in the news, there's a lot of bad side effects with those type of drugs, especially ibuprofen lately. They're starting to really come out with some evidence that's not very flattering. So one thing we've always promoted, and actually goes to the root of the problem, is proteolytic enzymes. And you guys that have been here, you know this Zymane is something that we like to use. And what that does is that material that's caustic to the nerve, it leaks out of the disc. These are enzymes that go in there and gobble those up and take them out of the equation so that they don't sit there and irritate the nerve for long periods. And we've had good success with that at diminishing that. Of course, you'll still have the mechanical pressure as well, in which case that needs to be evaluated for, but and we can look and see what would best remove that pressure for you. Otherwise, if that pressure stays there or that disc stays broken down, that can remain a permanent problem. If you don't get that to heal back up within time, you won't have enough material to work with. And then that puts you in a different office. So this is part 2. I hope that was helpful today. That described a little bit what disc is, a couple ways you can deal with it until you can get it managed. As far as home care goes, there's lots of things we can do, and it's a matter of keeping those hips loose because those will pull down into that. And we can give you a couple of hip exercises that will help with that as well. And core. core helps stabilize so you put less shock into there. So we'll share a core exercise with you here at the end of the video. But those two things, but the main thing about a disc is they can be tricky and they can be things you don't want to do early on. And so those are best to be evaluated for. So this is probably the one that we have the least to do right up front. And then we can, that's good to get evaluated for. And then the other ones, you'll see more exercises, but we'll have a couple in here that'll help you with preventing a disc. How's that? Thanks. Have a great day.
First exercise that we're going to do is called a side lying quad stretch. This will help stretch the front of the leg, the quad here, and also the hip flexor all up through here. So what we're going to want to do is lie on our side. We're going to keep our legs nice and straight, and we're going to take this top leg, we're just going to bend it back, grab the foot with the hand, and pull the upper leg back until our knees are right in line with each other. We don't want to drift up like this. We want to keep them nice and low and keep our legs nice and straight with our body. The further back we push this top knee, the more we're going to feel it in our quads and hip flexor, anywhere we're feeling tightness in that top part. With the other hand, you can help support your head. You can have a pillow here, however you want to do this. And we're going to hold it for 20 to 30 seconds. And then we're going to let go, turn over, and we'll do the other side. All right, this next exercise is called a bird dog, where you're going to want to go on all fours on a mat here, or anywhere that's comfortable. I'm up on my fists just because my wrists kind of hurt if I go flat on the ground, but go flat on the ground if you can. I'll be up on my wrists. The main goal here is to put one arm up with the opposite leg and just stretch out as far as you can, trying to get the arm and leg nice and straight and parallel to the ground. So we're going to give this a go. Tighten up that core. This is our core exercise. Tightening the core, back down. And we're going to do the other two. Tighten the core. Oh, you can see that stability is a major factor in this exercise. Come back down, and we'll repeat this for 10 times on each side.